problems. That now we will know how it is used in autism. First, who introduced this? If you have read Clinical Materia Medica by Farrington, there he talks in this book, he talks about in mineral remedies, he will talk about acids. Then he gives what are the common symptoms of acids. And then you read about metals, common symptoms of metals, and some plant remedies. If you have not read this book, as one day we were discussing in the group, necessity of reading basic books in homeopathy. I see a lot of people have not read basic books like Boric, like Allen and Pathak. There are so many basic books. I think either college has not told us or we are not aware that there is such books exist. There are two books which I suggest by Farrington. One is clinical and another one is comparative Materia Medica by Farrington. Both books are excellent books. If you read that, you will understand what is the importance of PEM in our practice. For example, there is one software called Synergy. In that you have reference work. So in reference work, you just put autism and see how many remedies come for autism. So I got all these remedies when I just wanted to see whichever case comes, first we take all the case and then work, then we see what reference work talks about. So no repertory has this MMR, Nowadays it is increased, it is included, but there are things which is not there in the repertory. So if you want to learn, then you can do all this. These are the special tools you have to use in your practice. Before going to PM, now a lot of people are talking about kingdoms. So there are 4 kingdoms, which is first one is plant kingdom, sensitivity and reactivity. Second is mineral kingdom, when patient talk about lacking, losing, or how much I am capable, what is my ability. They don't, blame anything, or they don't talk about this is causing me this is how I am affected. They say, I think I have some problem, that is why this is happening. So then we think of mineral kingdom. There is one more kingdom which is animal kingdom, that is they talk about survival. See, somebody is doing something to me. It is because of my mother-in-law I am suffering, or I want to teach them a lesson. This is all words of animal kingdom. And there is something, nosodes and sarcodes. There is one big beautiful example given by Rajan Shankaran sir in his plant remedy book. He takes love failure as an example. He says how plant kingdom people react. He says when somebody is, duped or have a failure in love, they come and they keep crying and see this has happened. Since then I am not well, I am crying, I am doing this, something happening to me. All those things are told by plant kingdom. When a mineral kingdom patient comes, she or he says, I think I have to improve something. He saw something which is not very good in me. So I need to improve that. Then only I think I will be accepted in love. Whereas in animal kingdom, says, how could he do that to me? I want to teach him a lesson. This is just an example, easy example to know how this is, but this itself is a big topic. But just to understand, I gave you this example. Now, nosodes usually, you get confused with mineral kingdom because they also say, because of this, I think I have some problem, that is why he left it. My love life did not continue. So, PEM and autism.
Dr. Jyothi, can you stop sharing? I will try to share.
Yeah. have to stop, right? Sorry. Yes. Not happening. Meanwhile, Dr. Rekha, this, I will talk about charts we use in this. There are 3 charts again: animal chart, mineral chart, and plant chart. We'll go with the mineral chart. When it comes to autism, today we are not discussing much about autism because other speakers beautifully spoke about autism. So, Dr. Rekha, this you can share only in autism group, not in that iconic woman group.
Okay. No, it's not possible.
It's not happening, right?
Yeah.
So by next this, I think I should learn through somebody how to do it. Okay. So many of you may be aware of this Charlton's chart. It is a periodic table which we used in 11th and 12th standard with a little, can you hear? Hello?
Yes, madam.
Yeah. With a little difference. With a little difference, I think we are all using this periodic table which is given by Charlton. So this is his book. Again, you have 2 books, Homeopathy and Minerals, and there is one more big book which is really useful in our practice. And Plant Families by Rajan Shankaran. This I have taken from Vital Quest. And there is a animal sub-classification. This is all the source from where you can read about this. So there is something called personal evolution model. This is developed by Dr. Mahesh Gandhi. So there is, here in this model, we have to find out age of the patient. Once we know where the child is stuck in his development, child may be from womb stage to the old age, but if we know where it is stuck, then we can use this chart. So from the mineral kingdom, there are rows and columns. There are 7 rows, that is from conception to disintegration. This table is replica of the development of a person starting from conception, fetal life to birth, infancy, childhood, teenage years, adulthood, and then finally old age and death. You can identify the row by knowing in which stage of development in an individual stuck in. There are 18 columns. It represents the different stages or phases of development of the structure pertaining to the row. There are 7 rows, as I told. Hydrogen series, that is from hydrogen to helium. Carbon series, lithium to neon. Silica series, natrium to argon. Ferrum series, kali to krypton. Silver series, rubidium to xenon. Gold series, cesium to radon. Uranium series, francium to plutonium. This, if you have read before, you will remember. Don't stress too much on this, because few remedies I will be explaining you with the Materia Medica this. So in row 1, there are 2 excellent remedies for autism. That is hydrogen and helium. What hydrogen is? It is like a cannabis indica in autism. Here I want to tell you something. There are some homeopaths now who are thinking whole homeopathic world is one, helping each one of us to unite with each other. That is hydrogen for you. See, this new group now is again one example for hydrogen. So the whole thing, they always think about others only. For them, there is whole world is one. Such patients with the autism require hydrogen. Helium, it is a very good remedy for autism. They don't feel like entering this world. They prefer to stay in themselves to experience their own being. Their behavior makes it very difficult to understand for other people. You can't get a grip on them, as if they are slipping away through your fingers each time you try and establish contact. This can be seen in autistic children. They won't let you come near. They'll be, it is very no eye contact also. And whatever they speak which above our knowledge actually. In row 2 we have 2 remedies, lithium, phos and oxygen. We all know phos is a good medicine for autism. There are some, remedies, whoever you ask, tuberculinum, phosphorus, lactalfinum. As such remedies are very boron, borax, are all very common remedy people use in autism. In that main is phosphorus. But with the symptoms of phosphorus, if you have symptoms of child performing very well one moment and very bad the other next, this strong altercation makes us think of stage 1 and of lithium in particular, because lithium comes in the first column of the second row. There is one more remedy from the row 2, that is oxygen. They have lot of violent breaking or destroying kind of energy, breaking away with connection with the parents, confusion about time and identity. From row 3, these row remedies are very much indicated in autism disorder. Not only child but mothers also show lot of symptoms. Mother's history during pregnancy gives indication to these remedies. Theme of company, communication, love, care and attention helps in studying these remedies. For example, child having difficulty in talking, writing, reading usually gets remedies from this row. Many of you must be having very good experience with natramure for delayed talking. I have so many cases of autism and generally they say my son, it is almost 3.5 years, he is not talking. Then few doses of natramure has really helped that child to, that child within 2-3 months start talking. So natramure is a very good remedy in this row. Talking difficultly mostly from first few stage of this row like natrum, whereas difficulty in listening usually muriatic. That is later stage of the row. When you see row 3, natramure comes in the beginning and muriaticum comes in the last. So talking and listening, because they don't listen properly, they have difficulty in talking. So natramure as a salt, if you give, it shows excellent result. Similarly, magnesium mure, which is also in the same row, is often used remedies in autism and delayed speech and other things. Row 4. Control and rigidity are 2 important themes of this row. Chaos, confusion, lost, bewildered and strange. From this column, we have cubeba and camphora.
Dr. Jyothi, can you see the mineral chart I have shared on my screen? Can you see?
But ma'am, now we have done
Yeah, I will share some other one also, whatever you are doing. You are doing
Yes, Dr. Bindu, we can see the screen.
I I will share
Dr.
another.
Bindu, you can share plant now, if you don't mind.
Wait a minute. Wait a minute. Time.
And then later you can teach me how you shared. Bindu is a dear friend, guru for all of us.
Which chart do you want now?
Any chart, any plant chart. From the column 1, we have 2 remedies, which are very,
Now I rarely use this. Because I have printed with me, so I use those things. But I will share this. It's the simplest one. और क्योंकि because जल्दी से वो ढूंढने में मुझे प्रॉब्लम हो रहा है. Wait, I will share.
Ma'am, the medicines were cubeba and
camphora. No, I
Now
just
this
wanted
is the
to
simplest
one.
part.
Yeah. This will do, doctor. You can enlarge it if you can.
Is it okay?
Yeah.
This is the maximum I can do.
So from the first column, if you see Magnolidae, we most often used remedy in autism according to PEM is Cubeba, child is immature, needs to get what he wants here and now only. Angry and cursing, perhaps when things don't go according to his will. Abusive, lewd, obscene talk and shameless behavior. Involuntary urination, craving for milk and raw food. Whereas Camphora officinalis easily learns foreign languages, it feels like a stranger in familiar places. Afraid to sleep, afraid of dark, of night. The fear of death is often related to fear of disappearing, dissolving, of being gone. Terrible fear of being left alone. Next is column 2, Hemamelidae. This column corresponds to the period in which, sorry?
This is better, you see. Can you see? With colors?
yes.
I'm not able to see because I am concentrating on my this. This
Dr.
one.
Rekha or someone can tell me. Can you see the colored chart?
Yes.
Yeah, we can.
Yeah, where it is written
This
before
one.
separation, here and there, struggle
Yes.
for separation, nutrition, I and the other, and I and the group. These are the 6 columns.
Yes. In that
Now?
second column, Hemamelidae, this column represents to the period in the womb from the 3rd month after fertilization until the birth. It is the stage of the unborn fetus in the post-embryonic period. Sensations here will be heavy, dragged down, pressed, compressed, shut in and open, free and flying. In this, we have few remedies. One is cannabis indica. The essence of cannabis presents a central opposition between restriction and freedom. Feels restricted and threatened by the physical world. Living in reality doesn't feel pleasant, especially when it comes to course demanded by daily life like school, homework and other things. They want to fly away towards the light, wants to be caressed. Addictions and tendencies, increase appetite, anorexia and bulimia. There is one more remedy, ficus religiosa. Concentration is difficult, cannot fix the attention, exhausted following mental effort, feels he is not being heard. There are few non-plant remedies in this group, which has a tannin which we see in the following remedies. One is gallic acid. The main theme here is the unwillingness to grow and mature. Fear of being alone. Fear of being separated from their parents, even losing eye contact. Always demanding to sleep with parents. Separation of the parents could be an exciting cause here. Very jealous, wants all the attention. Fear of death, afraid to fall asleep. And Gala Curicinia rubor, that is oak gall, extreme anger and rage accompanied with lack of confidence and anxiety, with a sense of not belonging, and there is a homesickness. We'll go to third column, Cariophilidae. This is a stage where the fetus is coming out of the womb. Sensation will be small and big, up and down, because it is falling down, no? You see all that up and down symptoms. In this column, we have Anholium luvini. There is one case by Acker in that book. 15-year-old boy comes with case of ADHD. Boy said, I find myself sitting and staring or feel an uncontrollable need to move. I like sports and drumming. That is where I can show my anger, which I have a lot. Wants to be alone, less social. I am angry at injustice. His interest and hobbies are art and history. Wants to know real meaning of religion, which doesn't have answers. Fear of dying. Dreams of huge shape, which is very big and suddenly it shrinks. That is what we told, no? Small and big. He had bedwetting, which he doesn't want to discuss. After remedy, his concentration improved and bedwetting has also gone. See, anytime we thought unholy num for bedwetting, no. Only after all reading all these things, no, we can think this remedy in bedwetting also. Column 4, Delanidae, mother and child relation, ability to remain stable, lack of protection, vulnerability. It, somewhere resembles row 3 of the periodic table. In this, we have some remedies. Thea, that is prepared out of tea leaves. As it is mother-child relation column, mother's history during pregnancy is very important. Mother immature and unpreparedness to be a mother. Today somebody was giving, Dr. Bhuvaneshwari was giving, the causes of autism. So this is also one of the, great remedy for unpreparedness of a mother to conceive. Impaired motherhood, such as impulse to kill her children. This can manifest also as suicidal depression after delivery. In child, terrible attacks of rage, altercation of mood, great lack of confidence, restless and hyperactive babies who can't fall asleep at night. There is also one more remedy, chocolate, a great remedy for autism, and cola nut. Also, we can think about cola nut in cases of autism. Column 5 is Rosidae group, me and other, taking one's path, facing masculine principle. Here, from the till 4th you have more of feminine principles. From the 5th we see masculine principle. Time of a father. Father enters this column under parental suppression. Rules, regulation and rigidity. In short, very strict parenting. Remedies here is granatum. Row 1 in column 5 is connected to death, birth and everything it entails. Collapse during the birth and general difficulty with separation. There is also dominant behavior like a queen and excessive need for attention from the father. There is one remedy which is prepared out of flaxseed, that is Linum usitalicinum, which can be used in this, and coca for adult ADHD. Column 6, asteroids, they are masculine, superego, return to being with the world while maintaining individuality. Column 6, we have many remedies like belladonna, capsicum, stramonium. These remedies, we are using in cases of autism. So this is an animal chart. Dr. Bindu, can you share animal chart? This chart is prepared by Dr. Mahesh Gandhi. He has divided this into invertebrates and vertebrates. Again, he has divided two into three parts: aquatic, that is water; terrestrial, and aerial. In water, again we have this water, earth, and fire. So in animal kingdom, we have mammals, spiders, fishes, mollusks, sponges, reptiles, amphibia. From this group, lot of remedies are used for autism. Like many of you must be aware, Lac dolphinum is excellent remedy. Many cases we have seen in TOS and in our practice also, is excellent remedy for autism. So from mammals, Lac llama, Lac felinum, Lac humanum, Lac delphinum, and Lac lupinum. In spiders, you all know Tarantula hispanica is a very good remedy for autism. We have some cases, right? And Arenia ixabola. From fishes, Asteris rubens, Gadus marua, Oleum jacoris, that is cod liver oil. From mollusks, we have squid. Spongia and badiga is a very good remedy because this is all invertebrate, no? You see lot of don't touch me like children in autism cases. Reptiles, lachesis, crotalus, horridus, and python. We have some python cases in our practice. And from amphibia, we have a bufo, which are very, useful in cases of autism. Nosodes, carcinosin, very good remedy. Tuberculinum, very good remedy. Medorinum, DPT, MMR, Bacillus Gardner. You know, lot of cases now we are attributing it to vaccination. Autism and vaccination is a big topic. So I have seen some, doctors prescribing either DPT or MMR, whichever is the last vaccination given, giving few doses as an intercorrect remedy for autism cases. Carcinosin, it is a wonderful remedy for autism. Child is mild, yielding, and sensitive to reprimand. Hyperactivity is not very marked in carcinosin patients. They are really calm. May have interest in artwork like drawing, singing, coloring, etc. Affectionate and sympathetic patients. Family history of cancer, diabetes, and coronary artery diseases. Child is often slow but agreeable and caring. I had one case. Mother had leukemia in childhood. After, where doctor said she is fit to get married, and then she conceived. But unfortunately, the child which was born was autistic, very mild autistic feature. Some doses of carcinosin really helped that child. Maybe lagging 1 year or 1.5 years in studies and development, but he is doing very well. Now he is 11-year-old. Okay, it's not very great this, but child is doing very well because from the history of mother's cancer, I had given him carcinosin. So this is a very, short presentation because PM is a huge subject. So we may, 1 month Dr. Rekha may keep only for PM, hoping. So there we can discuss all the charts, all the column and the rows?
Yes, sure. We are ready.
Yeah, we'll finish this very short one. But what is interesting here is, with all the charts, no, if you see, first few 3 columns, 3 rows, all represents womb stage. Autistic children, they feel they are still in mother's womb. That is why they are so sensitive. So that sensitivity, makes us to go for womb remedies. Even stramonium, when you see in the chart, comes in the womb stage. So that is why they have a lot of fears, lot of fear of darkness, fear of ghost, just for example. So if you understand that, then I think it is very easy to select the remedy. Maybe we will do in detail some other time. Okay, I think.
Madam, discuss any cases of you, madam. One or two cases of you. Huh?
Most of my cases of autism, although it is a very long follow, many autism cases, I am very, proud to be homeopath when I could help them in talking. Lack defineratum, there's a big problem, in speech, delayed speech, not able to speak. So, shall I finish this and then answer this question? So, natrum mur is a great remedy when you have delayed speech in autism. I am not giving you a specific, but when you see how it works, then you can, as beautifully Anne Scholten says, listening, speaking, both is a problem in autism. So in that case, natrum mur you can try, and similarly we have lac delphinum, dolphins. This so natrum mur I started with 30, then gradually 200. For 1 or 2 patients I had to give 1M because mother's history during pregnancy was very bad. So I had to increase. Other 200 is, I think, enough. 200 will help. There was one more question. Carcinosin when was given? For whom it was given? It is given only to the child. I did not give anything to the mother. Child received carcinosin. And it did very well. I am very happy still with me only. Carcinosin is 201M. I don't give NoCed in 30 potency. I had given few doses of 200 and only once 1M.
Ma'am, in autism cases, do you use single remedy for a prolonged follow-up time, or you change according to the child's behavior?
Actually, very frankly, no. Single remedy is more than enough for autism cases. Don't keep on changing remedy. Many times that is what we were doing mistake before. Wait, if it doesn't work for 2-3 months, then your prescription is wrong. Otherwise, if your prescription is right, stick to same remedy. Maybe you will change the potency, but don't keep on changing the remedies. If you are very sure that it is because of vaccination, then as an interconnect you can give 1 or 2 doses of NoCed. Otherwise, I think the constitutional is more than enough. Stick to only one.
Thank you.
Yeah.
Ma'am, how frequently we should assess or the progress? Because you are saying that 2 to 3 months we need to wait for one medicine. But in patient, how do we do the analysis or study? Where
I
is he now?
usually ask them to report once in 10 days in the beginning. Because once I give remedy, every 10 days for not 4 months, 4 to 6 weeks I will take, just message me how is child doing. Then every month I want to see in person.
Okay, ma'am.
See, I had somebody was asking for a case. I had a patient who was studying in Montessori school. He was finding it very difficult, and all Montessori school does that screening. So they said, no, we think he is autistic. You change the school. Then they came to me. I had given him one particular remedy, 1 or 2 doses. Then within 3-4 months, parents, they told me, when we went to parents meeting, teacher told, no, there is a change. He is able to reproduce, he is able to sit in the class for longer time. So that is all, Patients themselves will give you the inputs. No, this is for how many days, They keep updating you what is happening with the child.
So there is one habit in, especially in America and other countries, they will all do detoxification, chelation, that. What is your thought about that?
Can you repeat? I didn't hear, sorry.
Yeah.
In America?
Especially in Western countries, especially American homeopaths, they will do detoxification, chelation, and all other things. We have seen protocols. What is your thought on that? Is that really necessary?
See, if indicated remedy works, it detox everything.
Yeah, I never do those things.
Yeah. You need not give separate remedy for separate things, With all due respect to their way of thinking. But if you know classical homeopathy, I think our remedies are better detoxifying agents.
Yeah. How often we get rare remedies?
How often?
We get rare remedies. Like,
you tell me how many times we used lac delphinum in our practice few years back.
no, not even once.
Boron. Boron was never in our kit.
Yeah.
Frankly, in my kit.
So, in a way, we have to be equipped to identify when they come.
Yes. As you practice, as you fail, you will know the rare remedies. Rare remedies becomes your regular remedies.
Correct.
I had one case, it's not autism, lac suyus. This pig's milk.
Okay.
That was never in my dictionary, in my kit or whatever it is. But because we are reading more things, we are attending webinars like this, and we are reading new books. So, rare remedies are becoming our remedies now.
Yes, I had used gallic acid as based on that sibling rival.
Okay.
Excessive sibling rival.
Okay.
Torturing that elder brother to die. So, it helped.
Yes. In the future, in past, we thought all the salts of sulfur for, sibling rival.
Sibling.
Now we are going, little understanding has changed, right? There was one
Yes, doctor. Shall I share a case of delphinum?
Sure.
So it was not my case actually. So it was a learned case from a senior doctor. So what's the essence of the case is, He has been treating with an autistic child of age about some 5 to 6 years or something. So he has tried in many ways. This when lac delphinum was just introduced into our Medicare, that time, that age case, this one. So that time nobody of us are knowing about lac delphinum much. So that means I think this is about 8 to 10 years back case. So what after failing for so many remedies, after that once he is retaking the case. So one time the mother said that, today in party also he did like that. Something like today when you went to party, that also he did like that. So the party word is repeating more. So then the doctor suddenly asked that, how would this child be in party? So you are talking to the ladies at some time, at some other place in the party, and the child was being lost in the party. So how did you manage with that? So the mother said that because the doctor is thinking about camphor or something like that, like losing himself in the midst of a big party or big something like that. So he is being in the idea of that and row 1 of that is subclass 1 of plant kingdom. So the mother said that, no, that is not a problem at all. And the mother and father, they said that he can easily recognize his mother's voice in any number of people. Even if he is placed in 1,000 people group also, he will just singularly tuned to his mother's voice. So if his mother called him by his name or something like that, he will come to him. He will come and reach his mother with the voice only. So that is the main symptom of lac delphinum. So dolphins, they have that. Madam Kalai Selvi, madam, please mute yourself now. Kalai Selvi, madam, please mute yourself. So dolphin has that special feature of recognizing their parents or talking to their mothers with that wavelengths of special frequency. That means each dolphin mother will be having separate wavelength to speak to his to her child, and like that. So each dolphin will be having different wavelengths and supersonic waves and supersonic sounds like that. So dolphin produces much more sounds and it can sing also. No? So that is the symptom he catched, and he borrowed lac delphinum from London Pharmacy. At that time he said that it has cost about 1,500 rupees. So for 1 gram pills. So then he had given that dose. Within 3 doses in the span of 3 months, the child completely normal. And now it's completely normal and he is doing very great. And he did his, now I think he is doing his graduation also in masters in engineering or something. That much change with only 3 doses of lac delphinum completely changed the child. So, but the child is born autistic. So that was where I have had a deep desire to learn about PEM, and then I entered into Mahesh research classes like that. That was one case of lac delphinum, and one more case is of anhelonium. Anhelonium. This I learned from Dr. Kumar Davle sir. So Davle sir's webinar. So when once Davle sir was explaining, I think it was explained by Rajan Shankaran sir also.
Yes.
I don't remember. So the one autistic person, so he is very elderly. Elder means he is some 17 to 20 years or something. So he became suddenly autistic or ADHD or by birth he is like that. I don't remember, but that child he went to abroad only to live freely. He wanted that freedom. He is on drugs and everything because he wanted to live in another world. Because when he takes that drug, so he will be in another world and he is enjoying. So sir generally gave cannabis and everything. It did not work. So then after speaking to him more and more times, he said that one particular frequency of a musical instrument that is like a drums. It is like drums. So when he listens to that, he generally feels so much of cool and calm and more enthusiastic, more everything like that. So in a lot of instruments in the music also, he will be recognizing the drum sound. So depending on that, so sir has given anhelonium, where anhelonium is very, very particular to music and particular sounds of music, and while staying in another world, that means another good, pleasant world which he wants to do. So in this, the child is completely controlled by their domination of the parents is there, completely, in anhelonium case. So anhelonium 200 and 1M and has been given in many times, but not a single dose. This has been repeated for 1 year or 2 years, something like that.
Yes.
So then the child, he became a musician. He is not completely out of autism, but he is 90% better than before, and he became a musician. He became a musician where he became a renowned musician, not a small one. So like that, his life has been settled with anhelonium. So their parents are very, very happy with that drug, anhelonium. And one more, Shankaran sir was telling about Gandhi sir or Shankaran sir, I don't remember. So the helium, the case of helium.
Yes.
So where a homeopathic doctor is there in Europe, so she has been asking this case for her patient. So sir was guiding that case. The homeopathic doctor will be taking the case, and only once in a year sir will be attending there. So he has treated 2 years that case. So first time he has given some medicine, so it didn't work or something. So second time he has taken an elaborative case of 1 hour to 2 hours. Then he said that she is in her own world, and she wants that she is flying in the universe, something like that. So he has tried with hydrogen first, but afterwards he learned that is not hydrogen, that is a helium case. So because she prefers to be in her own world, she doesn't want to be with the other. She is good in her own world, like that. In that topic, so in that point, so he prescribed helium 200, and that completely cured the case. So this is where autism entered into my brain. I started learning more of them and started treating. So I have my cases also with borax and something. So I'll let them know in another session. So we are taking time.
See,
so
thank you for the time. Borax was what? Anytime we thought borax will be used in autism.
Yes.
Now it has become one of the best remedy.
Borax I have, madam, in clinic, but boron I don't have. So I thought that borax also will do. So whenever I want to prescribe boron, I used to prescribe borax. But it is not completely satisfying. So then I just brought boron only. I just bought boron, and that is working well.
Today also I have given one patient
boron case.
Thank you so much, doctor. Okay. All right.
We need more input about how we identify rarer remedies. Like it's a very big. Usually we can't think about that.
Yeah.
Sometimes you take 1 month that or 2 years.
Okay. Yes, Dr. Alka, thank you so much.
Yes, thank you so much, Dr. Udupi. I should be thanking you for sharing everything that you have told us. Yes, it was a wonderful insight into how to treat autism cases with the PEM method and using difficult remedies or rather rare remedies which are not usually thought of while prescribing. So your inputs were really very valuable, and I'm sure that those who are those who are present right now and those who will listen to you, I'm sure they will gain a lot out of what you have to tell. And I'm sure there will be people who would be wanting more and more lectures from you because you have